I will first start out by noting that he is a 34-year-old male, dressed appropriately for the weather, alert and oriented, has a pleasant affect, and I will introduce myself, do hand hygiene, offer privacy, and ask why he came in today.
Came in today because I've been having some diarrhea.
Some diarrhea. When did it start?
About 3-4 days ago, something like that.
Okay, are you having any pain with that?
A little cramping.
A little cramping?
Yeah.
Anything else? Is it achy?
Yeah, I mean, the
Any
cramping
sharp
is
pains?
no, nothing sharp.
Okay, where would you say that it's crampy?
Kind of in the stomach area.
Yeah, can you point to it? Is it like lower?
Lower.
One-sided?
Yeah, a little on this side, more on this side and less on this side.
Okay. Let's see, does it radiate when it's here? Does it go to the middle? Does it go around your back?
No, it doesn't go around the back, just kind of towards the middle a little bit.
Okay. Let's see. Those kind of talked about the character there, that it's a little crampy. Anything make it worse?
Eating.
Eating makes the cramping worse. Does anything make it better?
After I go.
Okay. Is anything, timing-wise, has anything been going on lately?
Not that I can think of.
Have you had any exposure to infection lately?
I've had an earache recently.
Okay, did you get treated for that?
Yeah, I went to another doctor and they gave me an antibiotic for it.
Okay, did you take that antibiotic?
Yeah, it was clindamycin, I think.
Okay, how long have you been taking that?
About a week.
Okay, did you finish the course of it?
Yesterday, I think. I think yesterday was my final day of it.
Okay, and you started having diarrhea when?
3 days ago.
Okay. Let's see, any nausea?
No.
Vomiting?
Mm-mm.
Constipation?
No.
Cycling with that at all?
No.
Okay, what about any recent weight loss?
Mm-mm.
Okay. Difficulty swallowing?
No, that's fine.
Painful swallowing? Any loss of appetite with that?
No.
Okay. Fever, chills?
No, nothing like that.
Any shortness of breath?
Mm-mm.
Chest pain?
No.
Any numbness and tingling in your extremities?
No.
Headaches?
Nope.
Dizziness?
Nope.
Any blood in your stool
Mm-mm.
with the diarrhea? Any mucus?
No.
Okay. Is there any blood in your urine?
No.
Any painful or difficulty urinating?
No.
Do you feel like you're retaining anything after you go?
No.
Any discharge? Any penile discharge?
Mm-mm.
Is there anything you notice in your underwear?
No.
Any bloating?
No.
Distension, tenderness?
Mm-mm.
If you push on your belly or anything like that?
I mean, no, not. I mean, like before, if it's starting to cramp a little bit and whatnot, then yeah, it gets a little like, ooh, I need to go.
Okay.
But
are your clothes fitting you any differently?
no, clothes are fine.
Okay. Any hemorrhoids?
No.
History of hemorrhoids?
No.
Okay. Have you ever gotten a colonoscopy before?
No.
Okay. What about, are you taking any medications like over the counters?
I mean, no, other than the clindamycin.
So the antibiotic's the only thing.
Yeah.
Any herbal?
No.
Any vitamins?
No.
Any NSAIDs like ibuprofen? Fast. Okay.
No.
What about medical history? Any heart trouble?
No.
With you? Any lung? Do you have a history of asthma?
No.
Anything like that? Difficulty breathing?
Like that? No.
Diabetes?
No.
Any history of cancer with you?
No.
Any hepatitis?
No.
What about for family history? Do you have any colorectal cancer in your family?
No.
Stomach cancer?
No.
Let's see. Esophageal cancers?
No.
Let's see. You said you've never had a colonoscopy before. Sure. What about any recent immunizations? Have you gotten the flu shot? What about, have you gotten Hep B or Hep A?
No, not yet.
You haven't gotten any vaccines in a long time?
No.
Okay.
Been forever.
Okay. What about surgical history? Do you still have your gallbladder?
No. Yes. I have my gallbladder, but I did do my tonsils. I had those out, 15 years ago. Seems like something like that.
Okay. Do you still have your appendix?
Yes.
Okay. Let's see. What about allergies to medications?
No.
Foods?
No.
Any seasonal allergies?
No.
Okay. What about, do you drink?
No.
Not at all?
once, twice a year type thing. I mean, no, not really.
Okay, smoking?
No.
Do you exercise?
Not as much as I should. Every now and again. Get
Okay.
out and run around, do something, but nothing consistent.
Okay. What about diet? What's your diet like?
It's not bad. I mean, just meat and potatoes type, vegetables. Try to eat at home a lot.
Do you eat a lot of fast food?
Not really.
How many times a week would you say?
Once or twice.
Okay. What about history of abuse?
Nope.
None of that? Okay. Let's see. What do you do for work?
I work just as a telephone operator out on the floor, or out on the lines.
Okay. So.
Technician.
Okay. Let's see. So the nurse grabbed your vital signs before this, and it was 98.2 was your temp. Your blood pressure was 118/62. Pulse was 68. Your respirators were 16, and your pulse ox was 99. One other thing I was going to ask you real quick. We can go back to it if I think of it. But we were talking about your diet, and I can't remember now. So we'll just go on
Sure.
to your assessment here. So as far as differential diagnoses, we've got 3 of them. Which one is a medication reaction. 2 would be some sort of a bacterial infection. And and 3rd would be some sort of IBS, irritable bowel syndrome development. I was also going to ask you timing. Have you been around anybody that has been sick recently?
Oh, no, not that I am aware of. I mean, I've been around people at work and whatnot, but nobody.
Do you have
has taken
kids?
off. No.
No kids?
No
Okay.
kids.
Okay, so any recent travel? That's what I was going to ask you.
No.
None?
Haven't been anywhere lately.
No. Okay.
Yeah.
Pets?
No.
Okay. All right. Well, we are going to go on and go ahead and do a little assessment on you here.
Sure.
I will have you lay down if that's okay.
Face up.
Yes, please.
Okay.
Alrighty. So first, I'm going to start out with we're going to leave a sweatshirt down here for now, but I'm going to start out with just simply inspecting his skin, and I'm going to note that it's warm and cool. It's not clammy. He's not sweating. The color looks nice and pink. There's no bruising. He doesn't look jaundice. I don't see any striae. I don't see any abdominal scars to note that he's had any surgeries, which is something that might clue us in on to what's going on with him. I don't see any dilated veins, and I don't see any rashes. Nothing wrong with his skin. So no obvious irritations, anything going on. So we're going to go ahead and we're also going to look at his umbilicus and see that it's not bulging, which could also lead us into what's going on. So that doesn't look like a problem area. We're going to also check the contour of his stomach and see that it's flat. It's not rounded. It's not scaphoid. Not protuberant. Not concave or hollowed. It looks nice and healthy. Doesn't look obese by any means. Let's see, no distensions, no bulging. Doesn't look bloated right now. I know he mentioned he gets a little bit bloated before he has an episode of diarrhea, but he's not right now. His abdomen is symmetrical. I don't see any asymmetry that could be indicating a mass right offhand or some sort of a hernia, enlarged organ. And I also don't see any abnormal pulsations going on right now. We can go ahead, we'll palpate for his aortic pulsations here in a little bit, but right offhand I don't see anything alarming. So we went ahead and inspected. Next we're going to go ahead and auscultate. So we're going to listen to all 4 quadrants for his bowel sounds and see, first off, if we hear any, if they're hypoactive, see if he's got hyperactive that could indicate some problems, and also listen for some bruits or some rubs here from the aorta here. So we'll go ahead and start in his right upper quadrant. And we're going to listen to each quadrant for a minute. So there's that. His left upper quadrant. We'll go left lower quadrant and right lower quadrant. And I hear nice normal active bowel sounds. I don't hear anything. He wasn't hypoactive. It doesn't sound like he has an obstruction, and it doesn't sound like he might have an episode of diarrhea. They're not hyperactive. And then I'll go ahead and listen for any aortic I don't hear any bruits noted, so that's also good. We'll move on to, let's see. Oh, and I also didn't hear any friction rubs. So that's good. We'll go to percussion, and we'll percuss each 4 quadrant here. We want it to sound, we want it to be, have tympany. We don't want it to be dull, because that means that there could be some sort of mass. So we'll start by percussing, and we'll percuss up and down here. So we'll start on this right side and percuss for the liver. So we're going to listen for tympany. So I don't hear any abnormal dullness that could be a problem from the liver. And we're also going to listen for the spleen as well. So we're going to start and percuss, kind of listen for masses. Here, if we hear any dull percussion sounds. We'll start up here again with the intercostal spaces. So no areas of concern, of dull sounding areas. Next we're going to go for light palpation. He mentioned that it sometimes is a little more crampy here on this left lower side. So I'm just going to start by palpating this right lower side, just nice and light here. We're going to do each quadrant. So go ahead and exhale for me. Inhale, a nice exhale. There we go. So I'm not feeling any rigidity. Is this tender right now?
No.
So because it's not tender, we can go ahead and move on to deep palpation as well. And I'm not feeling any masses, anything abnormal. Is that tender as we're palpating a little bit deeper?
No.
Okay. So it doesn't look like he's got something like peritonitis because he's not guarding. There's no rigidity. There's really no rebound tenderness. Is that?
Nope.
Okay. We're going to go ahead and palpate for the liver. So we're going to palpate on this right side. So if you could take a big deep breath in for me and let go. We're going to nice deep palpation here. And I don't feel his liver. That's one technique. And we can also, if he was larger and obese, we could do this nice hooking technique where we have him exhale and then kind of hook underneath his rib. It can get a little better feel for that liver. I don't feel his liver, so that is good. It means he probably does not have any hepatomegaly. We'll also do the same for his spleen and his kidneys. So we're going to just palpate, kind of come around here, and then kind of take some deep breaths in and let go. I also don't feel his kidney. On that right side, we'll do the left side. Very good. And then we'll do the same for his spleen. So I don't feel any splenomegaly, so we're probably not concerned about things like mono today, so that's good. Let's see. So we percussed for his liver and his spleen, did some deep palpation. Let's see. We might go ahead and palpate for his bladder, see if that could be a problem area here. So, see if there's any sort of urinary distension. He wasn't complaining of any urinary concerns, but since we're here, palpate that bladder. I don't feel it, which is also good. It means that he doesn't have any retention. And then we'll go ahead and assess his aorta, the aortic pulsations here. So kind of a little bit away from the umbilicus, about 2.5 centimeters or so. So I feel nice pulsations. They're radiating up. There doesn't look like he's got a AAA, which is good. So we definitely don't want that. So we will go ahead and do a quick lung and cardiac assessment on him. Listen to this. Nice S1, S2. No friction rub, no rubs, no murmurs. Pulse is right about, I'd say 70, 76, 78. And we'll also listen, if you could just sit up for me, and we will do a quick listen to your lungs. Looks nice, symmetrical, look like nice 2-to-1 ratio. Don't see any barrel tests, anything like that. So we'll do a quick, for time's sake, we'll just kind of fly through that, show you that, listening to all the lobes of the lung here. And then get that side lobe there on that right side. You can also go ahead and check his pulses here. We'll just check his radial pulses bilaterally. See that they're nice 2+. About 76, 78 pulse per minute, and then we'll also do his pedal here. Very good, 2+. So we'll go back to the differential diagnosis real quick. And I would say that he's probably got some sort of a medication reaction from that clindamycin he was taking for his ear infection. Probably just some sort of irritation of that intestinal mucosa since he took that. Sometimes you can have nausea, vomiting with that. He wasn't complaining of that, but maybe,
maybe in the future.
Maybe you could develop that, but mostly that diarrhea. And we might want to test for C. diff along with that, just because he was recently taking that antibiotic. I don't think he longer has a bacterial infection because he wasn't having a fever, wasn't really having that nausea, vomiting. Wasn't really having any weakness, lightheadedness, fatigue. Usually that's kind of a very abrupt type of infection, but his seemed to develop a little bit over those few days he was taking that antibiotic. He wasn't complaining of any tenderness, long-term distension of his abdomen. He didn't say he had any recent exposure to any sort of bacterial infection. And he wasn't complaining of any bloody diarrhea, which could potentially mean some E. coli, something like of that nature. And then we're going to go ahead and cross off IBS as well. Not having a lot of pain, discomfort, any bloating. And then he wasn't having that kind of cyclical constipation, diarrhea that some people with IBS get. And a lot of times you can develop IBS after that kind of a stressful life event, and he didn't state that he was having any sort of timing of a stressful event with that. Again, no nausea, vomiting, pain, any distension. It could have been triggered by his medication that he was recently taking, that antibiotic, but his other symptoms don't look like that's likely. And it's often worse with stress, and he wasn't complaining that there was anything super stressful going on. So that is our assessment. So thank you for coming in.
Thank you.